Thank you very much, Vladin. I'm very pleased to moderate this session. I'm very pleased to welcome France on board of this Digital Health Society Summit. We will have the opportunity and the chance to explore the digital health strategy in France and to talk as well about the project for the upcoming month in France. The previous session talked about the previous presidencies and already tease up the French one, which is upcoming next year. But we will first try to analyze what is happening in France since a couple of years, actually, with a new program that has been launched. And to talk about that, I'm very pleased to receive Isabelle Zablit-Schmidt, who is International Director and Health Europe Director at the Ministry of Health in France. Welcome, Isabelle.
Thank you very much, Julien, for the invitation and for the opportunity to share with you this state of play in France.
Thank you very much to accept our invitation. So, Isabelle, I will introduce you quickly before your presentation. Just for the audience, I remind that Isabelle will deliver a keynote presentation now, about 20 minutes, Isabelle, and then we will have the opportunity to ask some questions. So feel free to type in the chat box your questions, and I will take some of them for Isabelle. So Isabelle is International Director for the Ministry of Health in France. She's as well a professor at the University Paris 1, Panthéon-Sorbonne. She's as well an expert for the National Center of Scientific Research in France. She has been administrator of the French Digital Industry Syndicate during years. So you have contributed, Isabelle, to the digital strategy in France and the digital health in particular since many years. So you are very experienced and you know very well the French sector and the European sector and international as well, because you had some experiences out of Europe as well. And some experiences with European countries as well. So you're now in charge of the relationship with other member states, with the European Commission and the internationalization of this French digital health strategy. And I let you the floor now to just update us about what is happening in France about digital health. Thank you, Isabelle.
Thank you, Julien, for this introduction. Yes, indeed, it's already a couple of years that I've been involved in this, but with a different hat, as you pointed out. First, let me introduce you a little bit the context in France for those who are not familiar with. As you mentioned, I'm part of the health delegation of the Ministry of Health, which is, by the way, the youngest directorate of the ministry. So our organization was created only back 2 years ago. So a small team, but a lot of energy so far. And we have also a lot of talents in the Digital Health Agency in France, which is our operational agency. And we also have a major stakeholder in the landscape with the National Health Insurance Fund, the CNAM. And we everything we do it collectively. And we need, of course, the alignment of those partners to drive the health strategy. Some key facts: population in France is around 69 million inhabitants. We have around 3,000 hospitals. About half of them are private hospitals, others are public hospitals. And we have also a social care institution and above 35,000 social care institutions in the landscape. So just to set up the scene, because it's, I would say, a very big boat to move whenever you are doing, new strategies in France. So this strategy was issued from a report, a mission that was given by the government to Dominique Pont, who is now with Laura Letourneau, head of our health delegation. From that, we have an asset, which is an important one, is the fact that we have been publicly sharing a technical doctrine, which has paved the way for the innovation strategy and for I would say global interoperability between brackets of the system, because there was a lot of work to be done. I will come back to that, but one key element was also to put ethics at the core of the strategy, and that's the reason why in 2020 we also established the Ethical Council, and you will see also all the action connected to that. In 2021, we decided that it would be the year of the citizen. Why? Because we are moving to a major milestone of our EL strategy, and that will start at the beginning of 2022 with the fact that each citizen in France will have a direct access to patient data, but many more features that will come later in the presentation. And it's called Ma Santé, Mon Espace Santé, My Health Space, and it will be live at the beginning of next year, but we have already some pilots in place, and therefore it's already live in certain regions of France. You see on the top of the slides 3 logos, and they are very important one because as you understand, the roadmap was shared in 2019, but since 2021 we have a substantial acceleration of the roadmap. So this is very important, and again I will come back to that in more details. So the roadmap itself consists of a lot of actions, and under 5 orientation plus the connection with the Europe and international global context. So it's very, I would say, very much driven from a vision to an action plan. And so this is public, and we do report every 6 months to the entire ecosystem about the milestone, the achievements, about all actions that you have on the screen. Unfortunately, in French, but it's just to give you the broad picture about what it is about. Some key elements also are the transformation of the EHS agency, and it has been a huge effort and still ongoing process, with a lot of new hires and new initiatives that are driven by the EHS agency. We also have the creation of the National EHS Council, and this is an important institution where we have all parties from the entire ecosystem meeting, and also this is the place where we do report on the milestone of the EHS roadmap. But beside this, and probably the most important thing, is the fact that we've been establishing a lot of links with the entire ecosystem, because the strong belief behind the EHS roadmap was the fact that it was something that that had to be driven with the entire ecosystem. It's not only the authorities, the states, which is pushing down, a strategy. It's an effort from the entire ecosystem. It was the assumption behind this was that the fact that we were not so proactive in the EHS strategy, and we describe this as a collective failure. So it's not the fault of one person or one institution above others. It's a collective failure. And we wanted to change the mindset and go from a collective failure to a collective success, and also ensure the speed of action. So this is very important. And here you have on the screen the representation of the various committees that we have put in place to have the involvement of patients, to have the involvement of health professionals, but also private companies, and what we call structures, the various layers in the organization, and the regional structures. So you see, we try to have, I would say, not only radars, but also inputs and proactive actions from the entire ecosystem aligned with the EL strategy. So a key element really to drive the implementation of the roadmap. And what is the vision behind this? The vision is also the fact that, and we represent it very simply with a house. The vision is very simple, but it's a very powerful one. We have decided, and it was based on the book that Laura Letourneau, so the co-head of the EALS delegation, has written. It was based on the conviction that we have a third way between the GAFAM and the old world. This third way is the fact that the state must have a new role, and it's basically back to basics, where the state is defining, like for a house, what are the key principles, the key rules to play with, and the referentials that you have to put in place. In other words, if you are building a house, the state is going to ensure that there is a road, that the water is coming, that the electricity is coming, and so forth. The state will design, for instance, the size of the pipes and decide how it will be organized in terms of distribution. And it's basically exactly the same principle which is applied to EL's dynamics in the ecosystem. So the state is playing its role by ensuring that we have the core referential and technical standards in place, and that those ones are shared by the entire ecosystem. And that will be the basics to ensure the global interoperability of the system. And then we have some core services that are also provided by the state, like the utilities I described for the house. But more than that, if you are going to build a house, each citizen can design and build these sorts with its own partner. And it's where the private sector is also playing a role, because everybody can promote some innovations and ensure that they are compliant with the core referentials, and they also use the core services that are provided by the state. On the other hand, if there are some elements that needs to be put in place by the state, like social houses, if we compare to a city, the state will do it, but it's an exception, because we believe that the entire ecosystem, again, must have its role to play. The house is divided in three parts, and you see them, and I think that they are self-speaking. You have the services for the citizens, and it translates in my health space that I just mentioned. The services for professionals, and we'll have the exact mirroring ID for the health professionals coming soon. And the use of data. Some of you are familiar with the Health Data Hub, which is the translation of that idea of the use of data. And above that, we have, you see, some engagements and other very important elements as the innovation initiative, the evaluation initiatives, the support that are really around. And that means that the state, we used to say, is playing a role of a platform of services towards the ecosystem. And we believe that's precisely the role of the state. So this could be replicated in other areas, in other sectors of the economy. This is a vision that we have been applying for health. But by the way, it seems that it is an inspiration already for other sectors in the economy, because we have, I think, over the last 2 years, proven the strengths of such a vision. So it was a vision and a lot of energy to translate it. So I would say, thanks to the pandemic, we have also received a lot of political support. and also at all levels, including at European level, with the post-COVID recovery and resilience plan. And it has been translated in France by the Ségur de la Santé, which is the name of the acceleration plan. And the good thing behind this is that it forces, so to say, all the software providers in the ecosystem, and as well as the users, to move to the referentials and technical standards that have been shared in the technical doctrine of the e-health roadmap. So we are basically, with the acceleration plan, at high speed, aligning all the stakeholders of the ecosystem on those standards. So we have organized the work by we would say in a company business line by topic or areas of competencies in the health sector. I refer to the imaging, to the lab, to the liberal doctors, hospitals, and social care sector. So we have been working with all parties over the last year to agree upon the waves of acceleration plan. The first wave has been issued last July, and we have already have a very strong basis to move forward. And the second wave is due next year in July, and the next wave will embark also the European convergence in terms of requirements. The financing behind is extremely important. We speak about 2 billion euros. And 600 million of them are devoted to the social care sector, because as in many other countries, this is an area where there was also a lot to do. So a lot more to do. So it will be quite obvious that we have put in place wherever it becomes live for health professional as well as for citizen. So the big milestone, as I said, is the fact that we are going to have Mon Espace Santé deployed for every French citizen as from January next year, so in a few weeks' time from now. What does it consist of? It's 4 parts, I would say. First of all, a direct access to health record, and I will come back to that. A secured messaging system with the health professionals. That means that the doctor, for instance, can initiate a conversation with a patient, not the other way around, because we try to avoid to have spamming of the health professional with that. An application with 30 applications that are being referenced against criteria, including ethical criteria, but also, of course, the purpose of the application and the security of the application. And an agenda which is aggregating all medical appointments from the various platforms of appointment in the ecosystem. I come back to the health data repository. It was very important also to have all data being digitalized. We are still, and Julien maybe familiar with a system where when you come out of an appointment with a doctor, we have 5 up to 10 papers in our hands. As from next year, and together with the effort of the Ségur de la Santé, we are enforcing the digitalization of every single paper in the process. That means that the patient will have them digitalized and get the direct access to them via Mon Espace Santé. Mon Espace Santé will be available on smartphone and PCs, of course. But it doesn't mean that we erase the paper world. I mean, a lot of our citizens are not familiar with digitalization. So, of course, the paper-based system will remain. But on the other side, we'll have everything being digitalized. It will function with an opt-out system. So that means that if the citizen doesn't want to have that, he will not have Mon Espace Santé, but for the rest of the people in France, everybody will have direct access to health data. And you may be aware that it is also a milestone of the digital decade of the European Union. So we are also meeting by doing so this target. So just very briefly said, I said that there were 30 applications already referenced in the system, and there will be more in the coming months. Beside this, we have another program, which is a very substantial one with 650 million from the French government. And this is a special program, a dedicated program for digital health innovation. So the Ségur de la Santé and everything I told you before was really back to basics, putting the right referential in place, ensuring the global interoperability. But we go steps further with the Digital Health Innovation Acceleration Plan. It has been launched a couple of weeks ago, and we have a lot of initiatives around that. Some of them are already mentioned on this slide. They relate to training, upscaling of innovation, about the support of early stage startups, for instance, but also to accelerate the research. So every topic that is linked to innovation and that we consider that as being key to also enhance the innovation that we believe is really required in e-health. So that was really the mantra behind all this program. So one key element of that will be to, and I think it has been largely broadcasted over the last weeks, is the fact that we have been announcing with the voice of the President Macron, the fact that we'll also put in place a fast-track access for digital apps. So based on the nice idea that was developed by our German colleagues, but of course it will be, so to say, customized to the French requirements, and or also fitting also in the picture of the global roadmap of France. So we have some key elements already in place in terms of how we are going to handle this. And this is a very new topic for us. So I would say stay tuned. The next steps will come very, very soon and over the next year. I'd like also to stress the fact that maybe it doesn't transpire in the previous slides, but this is a very important thing for us as a team, is really to stress the importance of smaller steps. We have decided this vision, this strategy must be effective and must be translated in direct initiatives that are immediately, I would say, online for the health professionals and the citizen. If we are not able to translate what we are doing into something that is changing their lives, we are failing. So that's why we believe that it's very important to have smaller steps, maybe sometimes to decrease the ambition, but try to start the use case, see if it works and develop it over time, and then raise the bar of the ambition. For instance, in terms of technical standards, sometimes there are very low standards. We start the prescription, for instance, with a PDF file, but however, we'll move later on with structured data. And this is another way, but as soon as the use case is in place and is grasped by the entire ecosystem, then we can accelerate. We have seen that also with telemedicine over the pandemics. As soon as people are aware that there is a use case for them, then it goes much. It is, I would say, by design accelerated. So that's very important. And yes, on the slide, you also see that part of the European convergence, the key topics for us currently are patient summary prescription and vaccination card. Julien, you have asked me to speak a little bit about the French presidency of the Union, and I think it's also the link with the previous theme in the conference. I have to take some to be cautious about that, because you know that this will be in fact disclosed by the French president in December. So that means that some of the things can evolve according to.
Won't repeat to him.
Okay, but of course, and there is no secret that in Europe we are moving to the European health data space. So it will be a key topic of the French presidency. It has started a while ago, and I think that the previous presidencies have done a tremendous work around that. We are thrilled to take over in January, and two elements that will embark is the role of the citizen and the role of the central role of European values and ethics. This is also a lessons learned from the pandemic crisis. We have seen that being translated when we have been putting in place the European digital COVID certificate and the Federation of Gateways for Tracing Apps. So we need also to grasp on the lessons learned from that. If we have a trust framework like we did for the European COVID digital certificate, you know, in 12 weeks, we have been able in Europe to set up the technical requirements, the regulation, and move to the implementation. And more than that, it has become an international standard in just a few weeks' time. If we look back 2 years ago, nobody could have ever imagined that something else in Europe could be done at such a high speed and become an international standard. So we need to be to look back, and we are absolutely convinced that the fact that we have been ensuring that it was done with a trust framework in Europe, and it means that we have been designing the solution of the COVID certificate according to that. It's not something that we put afterwards. That's something that is really driving the design. That's very important as we move to the European health data space. Of course, it will be helpful to ensure the European leadership and response to health threats. That is a key element that also is a lesson learned from the pandemic, but also to increase the access to and the mobility of European citizens. You know that we have the directive for the cross-border healthcare. So we are going to move to a higher level on that. And we need also to ensure the innovation in healthcare, and this will be an extremely ambitious but very important journey. So what I can refer to is the fact that we have been mobilizing the entire ecosystem also to promote health over the French presidency. So with a lot of themes that will be covered in the various events we'll have. So you see them on screen. I'm not going to comment because they are self-speaking. And all events that we are going to organize are contributing to this European agenda from those various angles. We are extremely proud that a lot of stakeholders have raised their hands to contribute to the agenda. It's very important because it also shows the dynamics of what we are talking about, and also is a very positive sign for the ambition that we want to give in Europe. So 2 dates are important. First, we'll have a EAS high-level conference on the 2nd of February and an institutional meeting, a gathering of the EAS network expert in Europe in June. And above that, we'll have 20 events organized by the ecosystem over the 6 months. So I think that it's something that shows what I just said in terms of dynamics of the e-health ecosystem. So I'd like to take this opportunity also to thank everybody to contribute to that. And a lot of people around here will be also probably speakers or invited. And anyway, you are all most welcome to attend either online or in face-to-face events in Paris and in other cities, because these events will be held in various cities in France over the 6 coming months. So thank you very much.
Thank you very much, Isabelle. Impressive program for the presidency next year. 22 events on digital health in 6 months. I think it's a European record, I think, because having followed a lot of presidencies this last year, I didn't see so much events focusing on digital health, so it's impressive. Actually, the French, it demonstrates, as you said, the French ecosystem is pretty active in digital health, a lot of initiative, a lot of organization involved in that, and supporting the government in this presidency. So it's a good point. Thank you very much for this presentation. We are a bit late, but I hope Bledin will agree, but I wanted to ask you a couple of questions, maybe. So first point, what is interesting, I believe, I'm not saying that because I'm French, but what I believe is interesting in the approach taken 2 years ago or 3 years ago in the definition of the new strategy and the roadmap and the action plan that you have developed is the engagement of the different stakeholders, and the methodology you have developed around that is pretty interesting. This year, 2021, was the year of the citizen, especially. So you launched a number of actions in that. I wanted to ask you to give us some examples and the feeling that you had when you met with this Citizens for Patients Association and the feedback they gave you about this roadmap and this strategy.
Well, I think that we usually underestimate the voice of the citizen in the actions, because usually the digital health is described as an expert topic. Again, I think that you can have the nicest technologies and features and initiatives, but if they are not being in use, at the end of the game, it's a nice idea, but that's all. So we really try to avoid this, and listening to the citizen has been really instrumental in also the technical doctrine I didn't mention, but of course we are reviewing twice a year this doctrine, because this is an evolving topic, obviously. And we also listen to what the citizen is saying. For instance, if I take an example, communication with health professionals was very important. So that means that when we have been designing the health space, we have also included in the scope the fact that there will be a secured messaging system part of this. But also we listen to the health professionals, for instance, and at the same time, and they told us, okay, having a direct messaging system with the citizen is a very nice idea, but everybody will send us, huge flows of emails, and we are going to be totally disrupted by this flow of emails. So what can we do? So after a discussion, and we came up with the idea that if the messaging system was used with the condition that the health professional will initiate the discussion, will avoid a lot of these bad sides of the initiative. So that has been, one very simple example where we have been listening to both sides and agree upon the way of life, I would say, to improve the flow of data, the flow of communication, the speed of communication between all parties, and we as patients, we know how much important it is. So we had to find a solution, but we had to listen to that, and we do that through the various committees, and we have also some times in the agenda and various meetings with the citizen, where we go from cities to city. We eventually did a Tour de France prior to the COVID
roadshow.
Yes, and not on, and also, you know, places where we mobilize the citizen, and we share with them the concerns, the next steps, and listen to their reaction, and this paves the way for you know, enhancing also our roadmap and its implementation.
Yeah, this roadshow you mentioned, going in each region in France to meet the local ecosystems, the local stakeholders, is something that, well, I think was very original and disruptive in the methodology, yeah, for sure. To continue on this idea, the Ségur de la Santé is forcing, in a way, the health professional from one side and the industry from the other side to comply with the rules and the doctrine you have set up at the national level. What were the reaction? Obviously, you have put in place some funding to help this transition and to help the motivation, I assume, of the stakeholder as well. But sometimes money is not enough. How did you manage this discussion with the health professional from one side and the industry from the other side?
You said funding is not enough. It's just one side. What we believed is really it couldn't be a success without doing an effort of co-construction with the entire ecosystem, as I said. So that means that every stream that you have seen on the screen, and I have been driving the stream for liberal doctors for over the first wave, so I can really directly speak about it. We had workshops every week and several times in a week time, for instance, both with liberal doctors and with software providers, and sometimes all together also. And the idea was really was to see what was feasible in which time frame, and basically, if I look back with the starting point and where we ended up in July, the ambition was even raised with the construction the co-construction that we put in place. Another thing is that also we didn't want to go in the very difficult process of you know, you do provide the requirements, and they applied, and they have to sell it to hospital, to doctors, and then years later it's still not yet implemented, because with all the process and, you know, the noise over the process, it takes years to between the ID, the publication, and the implementation. So we have found a system where we directly finance the software providers based on the orders that they do and the orders that are compliant with the requirement. So this is really an innovation in the purchasing and financing process on both sides, I would say. And this is really effective, because at the moment we have already 50% of the software providers which are ready for instance, in the hospital. So this is really unbelievable, because in a couple of months we have been, so to say, breaking the rules, but in a nice way, because it's speeding up, in fact, the implementation. And of course, this is very much secured from a legal standpoint, because it's a European solution that we have found, and that is that we don't know if it was already put in place in other areas, but at least we can testify that it's really effective in terms of speed of action, and that was our target.
Sometimes we have, you know,
I'd say, sorry, just to add, because it was a lot of frustrations in the past. You know, this delay between a publication and an implementation. Everybody gets tired over the journey. So we wanted, to synchronize everybody and really limit the time frame to the utmost. So that was really the target.
Yeah, sure. Breaking the rules to speed up the process is a good example to follow. Yeah.
Basically, it's innovation in organization, so to say.
Exactly. Yeah, sure. Innovation at all stage, all layers. Last question. We are very late, but I can resist this question. And actually, we had in the chat a few questions about evaluation. I assume it was not clear in the chat, but I assume it was related to the type of solution that industry could propose to be integrated in this roadmap and to be integrated in the My Health Space, Mon Espace Santé, this application. So you talk about a fast track process, fast track access. When we can expect the requirements, it's during 2022, and the question is, will that be open to international suppliers, international industry players, to propose solutions for this space?
Well, everything is public. Everybody can apply. We have already international companies who have applied to some of the solution. The requirements are again made by, I would say, topics in health sector. So we have requirements for liberal doctor softwares. We have requirements for hospital software and so on. And they are public, and then the providers need to be referenced. And then that means that they are compliant with the solution. All the requirements must be met. And then, it's a very, I would say, very easygoing process. But I don't think it's easygoing to apply it. But I mean, the process itself is
it's easy to understand.
It's really streamlined at the utmost. Yeah.
And same question for this big investment program, part of France 2030 program, this 650 million euro invested in innovation for health. Is it accessible for international companies or international researchers potentially?
Yeah, I am not aware of any boundaries around that. No.
Good notice for international audience. We have, I think, more than 60 countries represented in the audience. So I'm sure many people will be pleased to see that. So we are coming to an end. We are already very late, but it was very, very interesting. We are very grateful to you, Isabelle, to be there today and to have presented all this strategy. I believe the final message is just check out what are the activities during the French presidency and the French digital health acceleration strategy starting on the 1st of January next year. And I assume we could invite all the international community we have here today to join the France to develop this new digital health innovation. What is your conclusion message and your message to this audience?
I think, as you said, it's a welcoming message, of course, during the French presidency, either online or in face-to-face meetings. We believe that it will be a major opportunity to cross-fertilize also the ideas regarding health. And I hope it will lead to set up this new ambition in Europe for health. So this is really the target.
Thank you very much, Isabelle, for being there today. Thank you to participate in our activities. And from the ECH Alliance and from DHS, for sure, we will support the French government and France in this presidency for the next months. So we will have the opportunity to discuss again, I assume, in a few weeks. Thank you very much, Isabelle.
Thank you a lot to all of you, and thank you to all participants. And of course, we'll be more than happy to react also to all your questions offline.
Thank you. And Bledin, I hand over to you for the conclusion of the day.
So, Isabelle, thank you. That was very insightful. I learned a lot, as I'm sure many of the audience did. absolutely fascinating to see what France is doing and already achieving. So I'm going to close today. I'm not going to speak for anything longer than a few seconds, rather than keep you all from your tea or catching up with your emails. So 3 thank yous. First of all, thank you to all of the attendees. Secondly, thank you to all of our speakers. And thirdly, thank you to Heather and to Bia, without whose skill and effort today would not have been possible. So I am incredibly grateful to them and to the ECH Alliance system team, rather, in the background that have made all of this possible. So thank you. I hope you've all had a good day, and I look forward to seeing you all on day 2. Thank you. Goodbye.